MAcRolide, or is it MAcRolide? Well, whenever you remember MAcRolide, you have to remember erythromycin. There are a lot of other drugs being clarithromycin, roxithromycin, azithromycin, and of course erythromycin itself. When we talk about erythromycin, we have to talk about where it was obtained from. It was obtained from Streptomyces erythris, and we use it against a lot of substances as an organism, such as Streptococcus pyogenes, Streptococcus pneumoniae, gonorrhea, Clostridium perfringens, Clostridium diphtheriae, Listeria, Mycoplasma, Legionella. Let's talk about the mechanism of action. Can you see that car? That car which is going ahead and trying to collide with a 50S ball? Well, the 50S ball is the 50S ribosome to which our car, macro car, goes and attacks. And that, my friend, is our erythromycin. That is why the car is red in color, and it goes and collides with the 50S ribosome. And in the base we have written pH is greater than 7. This indicates the fact that macrolides act in a pH which is greater than 7. They are very efficacious in the pH greater than 7. And you have to give macrolides before food because they are a bit affected by acid. Now see, the car gradually goes and collides with the 50S ribosome and it stops it from motion. As you see, there are no arrow marks now. But if you increase the concentration, which is denoted by the increased size of the car with all that ununiform thickness which is painted, you can see the red direction which is pushing the 50S. That means it is bactericidal. So as the concentration increases, it becomes bactericidal. Until and unless it's of the lower concentration, it is bacteriostatic. Then as we go ahead, let's talk about, yes, again, the mentioning of the pH greater than 7 is very important. Okay, this car takes the road of liver, that's indicated by the brown color. That means it is metabolized in the liver, and its destination, the excreta in the bile, or I mean it's excreted in the bile, that is the destination. Then strangely, if you look about its pharmacokinetics, as I told you, it's acid labile, and it should be given as enteric coated tablets. And we have to understand the important fact that it does not cross the blood-brain barrier. Then the preparation of erythromycin, which we are generally always interested in, is the erythromycin estolate preparation. But more importantly, we also have something else called as erythromycin stearate preparation. So these are two types of compounds. Let's talk about the adverse effects. But before that, can you strangely see this car having number plates or name boards in the front, in the back, or also on the top? Well, there are two E's on the back, there are two E's on the front, and there is one E on the top. The E on the top, it shows that it is an inhibitor of enzyme. The two E's on the back will represent that it shows enteral toxicity, and it is this erythromycin estolate is the way it is prepared as a preparation. Then the two E on the front will talk about erythromycin and the enteric coatedness of the tablet. Now, importantly, the two side effects, as I told you, the enteric toxicity is the biggest problem. So the adverse effects is that it causes diarrhea, epigastric pain, and it stimulates the motilin receptors in the gut. And the other E represents with the erythromycin estolate is that it causes good amount of hypersensitivity reactions, skin rashes, drug fever, and eosinophilia. And it is especially seen with the erythromycin estolate preparation. Going ahead, talking about the drug interaction, can you see in between the car there is a heart? Well, that heart depicts that it will precipitate ventricular erythemia when it interacts with terfenadine. So that's one important drug interaction which you have to remember. And as I told you already, it's an enzyme inhibitor. It increases the concentration of other drugs in the blood and causing toxicity of the other drugs. Then let's talk about the drawbacks of erythromycin. There is a 4 to 5 drawbacks in erythromycin, that it has very narrow spectrum of antibacterial activity. Our red car does not go too far. You can remember that. Then it has very low oral bioavailability. It has shorter duration of action, and because of its GI side effects, the patient is not ready to take a lot of erythromycin. So to overcome this, we created our new drugs, that is roxithromycin, clarithromycin, and azithromycin. All of them were semi-synthetic. They had their own benefits, mainly mentioning the fact that they were better for the patient, then the fact that it was long acting, then the fact that it had diverse range of action on all the bacteria, then it was acid stable, then it was completely absorbed from the stomach, and it had that's all. These are the most of the things which I have to remember. Now let's talk about azithromycin. Do you remember the throwing an azithro into the person who was having a soft voice? Well, that was the story of a soft canker caused by Dukrei. So in azithromycin, as I told you, it's given orally and intravenously, and it does not cross blood-brain barrier. It's mainly used for H influenza infections, and it is long acting. It's longer acting. Our azithromycin acts long time. That's why for the soft guy, you only give 1 tablet for a whole day. Now let's talk about the antibacterial spectrum and therapeutic uses of macrolides. The drug of choice, that's what you have to remember. The drug of choice with a plus will indicate a mnemonic that the new league of clammy dipping chanks. Okay, what does this mean? There are a league of people who are having a clammy skin basically, and they're dipping, and all of them are named chanks. Okay, the new league of clammy dipping chanks. The new would suggest when we start with the new would suggest M. pneumoniae infections, and azithromycin and clarithromycin are often used for community acquired pneumonia. Then you have the league means legionnaire pneumonia, and azithromycin is the drug of choice, and it has good tissue concentration and excellent activity. Then you have chlamydia. The clammy will remind you of chlamydial infection. This is again the drug of choice which is here used, and it is also used in lymphogranuloma venerum and urethritis and chlamydial pneumonia. Then you have dipping. In the dipping you have 2 letters especially. One is diphtheria for D, P for pertussis. For both of them you have erythromycin, which is the drug which is used. Then you have as you go ahead for cancroid, as I told you, you throw an azithro into the mouth of a cancroid person. Then let's talk about the alternative drugs, which it is used in alternative to patients with who are having penicillin allergy. In case of tetanus, in case of streptococcal infections and MDR typhoid, you use them. And then at last, in other uses, you use them for infections of H. pylori and MAC, right? So that MAC being Mycobacterial avium complex, it is used for that. So you also have other ketolides, other drugs such as ketolides and spiramycin. Spiramycin is specifically used for Toxoplasmum gondii, and you can remember Gundi with a spira. Then you have ketolides. That ends the story of macrolides.